So the reason I do what I do is I'm a radiologist and we don't get a lot of patient contact depending upon what you do. I love speaking to the patients. I love calming the patients. One of the lines that I use with patients on the biopsy day is, while this is not routine for you, this is routine for us. The Mammotome Revolve helps us be efficient in our procedures, less pain for the patients, and I feel comfortable and confident that I can assure them that this, while it is something they're nervous about, we will make this experience as best as can be expected. And we meet those expectations, and our patient satisfaction and feedback scores show that. We are going to do a stereotactic biopsy using the Mammotome Revolve and Confirm. This is the area of concern. The patient is presented with some calcifications in the right breast. I'm going to use sterile technique to prep the breast. I take a syringe, place it down into the breast the entire length of the needle, and as I'm withdrawing, I slowly inject lidocaine with epinephrine along the expected tract of the Mammotome Revolve needle. At this point, I make an incision in the breast, get the needle in place, take images at the site of biopsy. The Mammotome Revolve has a very fast firing speed, and particularly in patients with dense breast tissue, that fast fire gets through that tissue without pushing it, without pulling it. It is rare for us to push calcifications. I can't remember the last time we've pushed calcifications. It has a nice crisp fire, a nice sharp blade, gets through those tissues efficiently, quickly, so we can again do an accurate procedure. I inject lidocaine with epinephrine directly into the biopsy cavity, rotating the cavity so that the entire biopsy cavity is exposed to lidocaine. We are going to take our post-fire images to make sure that our calcifications are directly above the aperture. We have targeted the area of interest and we are ready to begin taking our samples with the Mammotome Revolve device. By targeting underneath the lesion, I can verify that my probe aperture is in line with the calcifications. This allows for specific tissue acquisition and minimizes taking samples from areas that may not be involved in the disease process. With the Mammotome Revolve device, I have the flexibility to change my aperture so I can access thinner breasts without having to change the probe if necessary. The vacuum strength gives me plenty of tissue. This provides me with confidence that I'm going to have adequate tissue to get an accurate diagnosis. I've found the suction works really well. It's a closed system, and so we don't have trouble with vacuum leak, we don't have trouble with connections. The vacuum works consistently. The Mammotome Revolve, the way it collects the specimens, enables you to separate out the tissue in its individual cavities. Compared to other needles I've used, this has been a game changer. I need to know where each specimen came from. So if it's in chamber 1 through 6, I know where exactly in the breast I took each specimen because I do it the same every time. So if I know the calcifications are in specimen 2, that would be the 2 o'clock position. If I only have calcifications in specimen 2 and I need to go back and get more calcifications, I know to target the 2 o'clock location because that's where the calcifications were, assuming they were all in a tight cluster to start with. So having the tissue separated out in the chambers so I know where they came from is extremely important. Other needles that I've used in the past, they would all come out in a clump in one chamber, one collection bag, and so you wouldn't know where each piece came from. So while you might know that calcifications were in one core, you don't know where in the patient's breast that core came from. So having that collection cup is crucial to just getting a good biopsy. Having the Confirm directly in the room on the counter right behind me has really drastically decreased our biopsy time. I can just turn around, the technologist already has the specimen out, ready, in the tray, takes the x-ray, and it's only seconds until that x-ray pops up. We will tell the patient right away, in the room, right then and there, we have your calcifications, we have your specimen, we're gonna put that clip in now. It dramatically reduces our procedure time, and it's been a great asset to our practice. The other time I really like the vacuum is when I'm checking the specimen with the Confirm system behind me. One click, I put it on continuous vacuum, it flushes the cavity with saline and also puts on a continuous vacuum to clean out any fluids so there's no hematoma or any fluid that's collecting.
So having the tissue strips automatically take the tissue out, it's made the process a lot cleaner, it's made it easier for the techs, creates a quicker turnaround process, so it makes it easier for everyone involved. Using the Mammotome Confirm and Revolve device, it has helped decrease our wait times and increase patient satisfaction due to having a quicker turnaround time during the procedure.
Now I will deploy the Hydromark clip. placing the marker applicator down the Mammotome Revolve device and aligning my arrows to ensure proper deployment. Placing the marker through the revolve so that I know that my marker is at the biopsy site. The company provides a specific distance to withdraw the Mammotome Revolve and then put the clip directly in there. Following those guidelines, that clip is right at the biopsy spot, right at the geometric center of the biopsy spot, which is where we want it, so that if we have to go back and do a wire localization, or you just want your post-procedure mammograms to have your clip exactly where you intended it to be, so that you know you did your procedure correctly. It stays where it's supposed to, it doesn't drag out, and so that's been a great asset to our practice. The most important aspect that I've found with the Hydromark clip is the long-term visibility under ultrasound afterward. We have switched to exclusively doing our wire localizations for surgery after stereotactic biopsies, doing those under ultrasound rather than using either stereotactic or mammographic guidance. It is easier on the patient to have it done under ultrasound. It is easier on the doctor to have it done under ultrasound. And the clips are extremely easy to see by ultrasound. You can pick a shorter distance perhaps. You can pick a better surgical approach if the surgeon tells you, I want to come from this direction. It's just easy to do under ultrasound. And there has never been a clip that we could not see.
Using the Mammotome devices, it has greatly increased our patient satisfaction due to decreasing the amount of time they're in the procedure. They're on the table a shorter amount of time, so they're much happier.
As a radiologist, having the combination of the Mammotome Revolve and Confirm decreases the amount of time that I have to spend in the room. While we want to spend every minute that we can with our patients, there are probably 10 other patients waiting for us. And so as the radiologist, it's important for us to get in the room, do the parts that we need to, and then have us get back out and help the next patient who's waiting. We can do more biopsies in the day, we can do more diagnostics in the day. It really increases the throughput of our patients and the efficiencies for the radiologist.